Warwick Medical School runs a 4-year graduate entry course. We have run a 4-year course since the inception of the school here, and we feel very strongly that those who've come to the course a little bit later in life with the experience of having taken a degree elsewhere are entirely capable of gaining the knowledge and skills necessary to complete a medical course in an accelerated time of 4 years. I think key is that the learning around topics needs to be integrated. Something we do in addition is to build our learning so strongly around case-based learning. In simple terms, case-based learning is learning that's undertaken by groups of students in a facilitated environment with a non-expert facilitator who's there to guide and help, but not specifically to teach. Within year 1, the learning is based on a 3-session case-based learning cycle. And in each of those sessions, the group of students is given information about that patient. And for example, in the second session, they may be given either updated information, additional information about results, information about progress of a health condition or other factors in that person's life. But around that case-based learning, there's a whole series of supportive learning, both in terms of lectures, other small group teaching, anatomy and skill sessions and things like that, some of which better prepare the students for the case-based learning and some of which follow on from the learning that they've done within the case-based setting. I believe it's very important that medical students coming to medical school are meeting patients right from the beginning. We have community days right from term 1 of the course where our students are in a community setting and both visit individuals and talk to them about their health, but can also follow them over the course of a period of time and follow that health journey with them. From term 2, our students are spending up to half a day in acute NHS hospital trusts, talking to patients, learning the basis of taking a history of examining patients, and learning really the basic skills that they'll be using throughout their medical career. When undertaking a medical course, it's very important that students rapidly gain skills in directing their own learning. We clearly provide a whole series of core learning opportunities, and we provide learning materials in terms of lectures and case-based learning sessions and other things like that. And in addition, we will provide specific self-directed learning materials, in other words, material that we direct students to and tasks that we give them for them to be working on independently. We get very strong and very good feedback both from local NHS trusts but also occasionally from people in more distant places who've employed and worked closely with Warwick graduates. And it's very gratifying to hear them often described as mature, capable, sensible, and indeed we've had a number of individual approaches from elsewhere in the country from doctors saying that they would be delighted to employ future Warwick graduates, that they feel they've been very good as both foundation doctors and as doctors later in training. Phase 1 of the course is about the foundations of science and medicine. It takes 1 year and is divided up into 5 distinct blocks of learning. Each of those blocks is 5 weeks long, and each week is centred around a case that the students are studying. But the case itself is not the totality of their learning. There are lectures, there's interactive group sessions, there are community sessions, there are skills sessions that are based on the topic of that week, and there are also clinical sessions within the trust where students are building up the basics of history and examination. So phase 2 comprises the second year of the course. And when we built the phase 2 in the current curriculum, we were really looking at improving the transition of students from a fairly standard learning environment to full-time in the clinical learning environment. The clinical environment, both in terms of hospital settings but also in terms of community and general practice settings, can seem a very alien environment when people first enter it. If you can imagine for the first time going into, for example, an operating theatre, you're surrounded by strange equipment, strange smells, lots of unusual situations, and that environment is populated by people who are entirely at home there at a time when you are new and unsure. And therefore, we've tried to design phase 2 to have early experience and a series of opportunities for students to become comfortable in a whole variety of clinical learning environments. When students finish phase 1 and start phase 2, they've been in a clinical environment often in a very controlled way, often with a very clear teaching remit. And as they move through phase 2, they're increasingly learning alongside real clinical activity. They're watching real live outpatient clinics. They are there when operations are being undertaken. They are eventually becoming part of delivering that care as they become more senior and experienced, clearly with appropriate supervision. So phase 3 comprises year 3 and year 4 of the course here at Warwick. And it's really fundamentally about preparing students for foundation training and the move into the workplace. It actually starts with a student-selected component where students can undertake research or audit or service evaluation work on a full-time basis, either within the medical school or within an NHS organisation, either locally or sometimes at some distance. There's then a further period of case-based learning, and then students move into a sequence of rotations around specialty areas such as care of the medical patient, care of the surgical patient, acute medicine, child health, obstetrics and gynecology, psychiatry and musculoskeletal healthcare. Following a series of rotations, they then undertake a revision block prior to final professional examination. And following on from the finals exams, students have an opportunity to go on an elective where they can undertake a whole variety of projects that they propose themselves, and then that's followed by a period of assistantship, which is really the final preparation for students becoming foundation year doctors. The medical elective is an opportunity for students to select what they're going to do for a block of time, and when we say select, we expect them to select from the broadest range of possibilities. Our elective is undertaken after finals exams, so it's undertaken by a group of students who know that they've already gained the knowledge, skills and abilities to graduate and to become doctors. And this hopefully allows them to then perhaps broaden their outlook and select what they want to do from really as broad a range of activities as possible. We have students who go and do relatively academic research projects. We have students who go and work with particular specialist clinical teams in an area that interests them. We have many students that choose to go abroad, and that could be to a whole variety of settings to see different healthcare systems, both in terms of comparable systems to the NHS, travelling abroad for experience, for example, in the United States, or travelling to places where healthcare is much more challenged and the delivery of healthcare is much more challenging. We have students who undertake medical journalism. We have students that have undertaken projects at NASA on space medicine. We have students that have undertaken projects relating to altitude medicine as part of climbing expeditions. So really, anything that is medical in the broader sense and has a reasonable balance between benefit and risk is certainly something we would strongly consider and encourage students to look at. So the prime aim of a medical course is to graduate doctors who successfully enter foundation training as competent doctors who also have the potential to then learn and develop into future generalist and specialist doctors. It's important that this is as smooth a transition as possible. Clearly, it's a very exciting point in a student's life, transitioning from being a student to being a practicing doctor, but with that comes lots of potential fears and anxieties. And it's important that students feel properly prepared for that transition. We do this by an extended assistantship period, and during this time students are very much working as they will be doing as a foundation year doctor, albeit with some minor legal limitations because of their status as a student rather than a doctor. Wherever possible, we undertake a period of shadowing where they're actually working with the foundation year 1 doctor whose job they will be taking on come August once they've graduated. At the end of phase 3, students graduate, clearly a very exciting time, and they acquire the title doctor, and clearly that's something our students have been aiming for, certainly for the time they've been here, but often for many, many years of their lives. They then move into the workplace, starting with the foundation year 1 programme, where they are still learning, as doctors do lifelong, but also working, meeting patients who are now their patients and treating their patients within a controlled and supported environment as part of the beginning of their postgraduate medical training as they move into whatever specialist or generalist career they are aiming for.